Ebusia for your mamunyina akwaba kesiye eba HRA TV so sabre musom for HRPK. His rare freshness became in my between komo. Israel onion share link na washa link no ama wabusia for. Wadofo unya manom na afedie. Yetime de komo amana aye kama. And then you ba Dr. Jacqueline BAMFO and Ebedin Komo. Producer Michelle, yeah, no co-host my real quick why. So they bet me a project ne Casano. But before we proceed, maybe some cabo be saying next week a topic is going to be about immigration, US immigration law. Into any about Dr. Lawyer Rhoda A. Frimpong and ebe did come on one next week. And if you have any immigration questions, okay, and any concerns concerning immigration, please let's make a date with our very own lawyer Rhoda A. Frimpong next week, same time, 6 p.m. US Eastern time, so that we can have a good time with her. And also make sure you come with all your packed questions and ask as proceeded. Before we proceed, I'd like to take this opportunity to thank each and everyone who has made it to today's show. And to say, today's your first time. Thank you for coming. God bless you. And also making time out of your busy schedule. And also, if today's not your first time, thank you for keep coming. And also, keep on sharing the good news and also sharing the message to others. But one thing that makes it better is if people can hear this message for themselves for the first time, because in Pentecost, it take a book crew. With that being said, if your sister, your mom, your daughter is not here, make sure you invite them to be a part of today's show, because today is about women, it's about mothers, our sisters, our aunties, and also our daughters who are of age, looking forward to pregnancies. And we know a lot of obstacles and contributing factors that are prevalent in terms of preventing pregnancies in some women. And this is what today's topic is about: fibroids and pregnancy. And with our very own Dr. Jacqueline BAMFO. So I will introduce her in due time, but I want you to take this opportunity of me talking to actually share the link, the Zoom link to others so that they can actually be part of it. With that being said, I would like to thank our sponsors for helping us and bring this show to you. Feel Good Homes. Also, we would like to thank Feel Good Services, as well as Oswald Wellness LLC. We would also like to thank so much Send for making this show a possibility. If you don't have the app, make sure you download it. And once you download it, put in my promo code PK, P-KAY, and get $20 on your first transaction. All you have to do, just send me a screenshot saying that, hey, I just did that. So please, let's take advantage of it before it's too late. I know there's some good news today. Director is ready to talk about the 100% cashback. And I've already whispered in my ear, say, as a medibi. We'll find out today from director. But I know, say, some people have already won money. And, let's see how that goes. So, director, please give us updates from startups. And then right after that, we're going to segue into our topic for today.
Yeah, PK, Mecha abusuafo a omaba so nyina omomye your first time coming, you're all welcome. This is a family-based program where you can share your thoughts, fun, and everything. We are here to learn too. PK, and I'm time we said any because the list and number and a dorsum. And nipa 70 and on I wouldn't take much time. So what I was saying is that today is the D-Day. Almost Sunday from the 1st of October to 31st of October. You be selecting mu qualify ni nyina you be selecting mu 70 omo be win. Obi bia obe win bia so ni sika o Sunday bia no you be total near their money back. So today is going to be a great day. But now ebinumo kana October no, the app was down and stuff like that. So we also thinking of repeating the same thing this month. Into this month and so omo I started sending no, there could be a lucky winner at the end of the month. Into PK, that is the good news over there. There's also
Bro,
another good news where
different
we
Jackie came
I'll
in
call
now.
A class to announce it when
Dr.
yeah
BAMFO.
draw now or be breaky that good news to us too. Now promo ni there yahyehyɛ no bundles. I mean yahyehyɛ no
Well,
a
I have watched
short
this several times
yeah
and
the
it's not
bremo
changing.
PK.
It's not making it.
Nti I wouldn't take much of your
I'm
time.
going
If
to
there's
maybe
any
log off
question or
entirely
anything
because I
you
don't
want
know what's going on.
us to talk about, then I go straight to it.
All right, that's it. Yeah, that's it. Thank you very much. Thank you very much. Dr. Balfour, we are trying to make you co-host, but it looks like say maybe our system doesn't allow that. Yeah, but we will still try to find a way um, to get you to become a co-host. But please, when you see that you've been requested to be a co-host, just accept it so that you can easily mute or mute yourself once we get into it. All right, Darita, thank you very much. We
Okay,
will find out.
Mame fa baako bi nsɛn twam.
Okay.
Mesrɛ mo, I mean, I'm hoping Sanki binya a lot of winners on this show today. Na munye yadom obi biara obewini biara no munye video na mumma yehu sampa. Ade na ya no ɛyɛ real because people might think say bia ye kind of saa kwa. So munye yadom ya na ma ye video na mu dia bre quick. Right.
Okay. Quick. Right. All right, that's it. Thank you very much. Okay, so today, like I said, our very own sister, all the way from the UK. So it's pretty late wherever she is, and she will be talking to us about a beautiful topic for today. If I must say, today is our first time ever treating fibroids and pregnancy on our show. The reason being that is, Ebemu said it will be very important to talk about that. And she already did that on the UK version. So we consulted, some people back doors to actually get us those information so that we get information so that we can actually get this information to our mothers, sisters, and aunties here in the United States and also Canada, as well as everyone across from the globe. So our sister is a consultant, obstetrician and a fetal medicine specialist. She's also the UK president of the Ghanaian Doctors and Dentists Association UK. Wow. Hey, big woman, oh. Extra big woman. Way extra large. Well, first of all, let me take this moment to this singular honor to welcome Dr. Jacqueline BAMFO to HITV on Time with Tata said. Doc, welcome to our show. Doc, can you hear me? Okay, can you unmute yourself if you can hear me, please? Oh, she's trying to unmute, but it's not going through. Let me try to ask you to unmute. Okay, I just requested for you to unmute. There you go.
Perfect.
All right.
Hi, good evening.
Good evening. How you doing?
I'm very good. How are you?
Good. You mind you share your camera with us?
I'm trying. I think you need to you need to do your magic.
We gotta go with the mute first before the work on the camera. Okay.
Okay. Let's try again.
While she's trying to get her camera rolling, please, again, if you're not sharing this link to your loved ones, especially the women in your life, I think you are doing them a disservice. Basically, I have to request for that too. Hey, Doc. Okay, let me see. Allow to. I think that is solely on your end. Producer, can you see if you can?
Okay,
Oh, there you go.
done.
Perfect. All right. Welcome to the show, Time with
Thank
Tata.
you. Thank you for having me. It's wonderful to be here.
It's a pleasure for having you. So before we, start, can you just tell us who Dr. Jacqueline BAMFO is in 2 minutes? Just 2 minutes.
Okay, I'm a consultant obstetrician and fetal medicine specialist. That means that I look after women and pregnancies that are high risk. So, pregnancies where there may be abnormalities with the way the fetus has developed, and pregnant ladies that have a range of complications from hypertension, diabetes, a range of medical conditions. So yeah, that's what I do. And I've been a consultant for 10 years. I've been a doctor for 25 years.
Oh wow, that's awesome. That's awesome. That's probably how long our director has been in Italy too. So you guys are probably on the same chase. Um,
Okay.
well, first of all, I want to say thank you very much for coming on the show and also taking on this invitation. Well, there's a lot of things that goes on in pregnancy. We've heard of ectopic. We've heard of you know fibroid, preventing pregnancies. Um, Sometimes we, the men, we do not take time out of the busy schedule to analyze what a woman go through, the hormonal changes, other things that can really weigh them down in terms of everything that goes on around their lives whilst they're still trying to keep up with men in life on the pay scale, the ladders of trying to survive, whether being a single mother or a married woman or someone with even with a partner co-parenting. Um, I think today is going to throw a lot of lights or shine a lot of light on this specific aspect of women and what you guys go through. Help us understand how fibroids and pregnancy can be either best friends or enemies.
Certainly. First of all, I'd like to say that this is for educational purposes. You must always consult your personal doctor and your healthcare provider, and because they are the people that know you the best. So if you have any personal issues, that's what you should do. So fibroids, what are fibroids? The traditional name for fibroids is actually leiomyoma. And a lot of times you'll search online and you'll find this. So when you see that, it's literally the same. I like to describe them as a ball of muscle inside the womb. So the uterus is also known as the womb. And they can be in different places. They are a growth. Okay, so they can start as a seedling, maybe 1 or 2 centimeters, and they can grow as large as a watermelon. And they can be in different places in the womb. You can have them on the outside of the womb. That's called a subserosal fibroid. You can have them attached to a stalk. That's a pedunculated fibroid. You can have them inside the muscle, and they're intramural fibroids. So you have different types of fibroids, really depending on where they are. They can actually also go into the lining of the womb as well. You can even get fibroids at the cervix. That's the neck of the womb. So they're dotted around in lots of different positions. And because they are in different positions, that also explains some of the different symptoms that women present with. They're generally more common. I mean, most women, actually, I would say at least 50% of women, maybe a bit more, would have fibroids at some time in their life, but more in Black women. I would say about 70% of Black women will probably have fibroids up to the age of menopause. Menopause is when the periods stop or the cycles stop. And that's at least 2 to 3 times more than white or Caucasian women. We also can't be 100% certain actually how common they are, because some women don't have any symptoms, and some women may go through their whole lives without actually having problems. So therefore they'll never present. So it could actually be more than this. We do know that it can run in families. So you tend to have sisters or mothers that have fibroids as well, have had a history of fibroids. Some studies suggest that it can be related to blood pressure problems. And sometimes, you know, I think there's also another study that suggested that some food additives may also be implicated. But what we do know is that estrogen, which is the female hormone, seems to be associated with this. So after the menopause, when the estrogen levels go down, the fibroids tend to shrink. Okay. So we still don't know 100% what causes them, but that's, you know, there's always a lot of research going on to try to understand more. In terms of what kind of problems they have, you know, it could be heavy periods, painful periods. Sometimes a woman will have always a big belly, or, you know, she may exercise and can never get rid of that bump. And that bump is because the fibroid is poking into the womb and actually making her tummy look much bigger. So she actually looks pregnant and she's not pregnant because she's got a big fibroid. The cycles can be irregular, sort of all over the place. And, you know, they can, because of the heavy bleeding, then that can cause tiredness or low iron counts. So, you know, some women may just always be tired, you know, and that's because they're constantly bleeding. Also, you can have pain because imagine you have these round balls in your pelvis rolling around. You may have pain in your back, pain during your periods, and also irritation of the bladder. So sometimes you can get frequency of having to, you know, go to the toilet all the time because of this discomfort. Or problems with your bowels, you know, just not being regular. You know, that can also be related to the fibroids. And then also during intercourse, you know, during intimacy, it can be uncomfortable, you know. And of course, all of this can have a toll on the mental health as well, because, you know, day-to-day living becomes difficult because you've always got these problems, you're always bleeding, you've always got pain. And then it becomes hard in the family because you still want to, you know, perform your role, but you're not able to because inside you have your own issues. And I think one of the biggest things is also the fertility issue, in the sense that getting pregnant can be difficult. And obviously that's what we're here to talk about today. How are fibroids diagnosed? Usually these symptoms would lead a woman to visiting the doctor, and then the doctor would, you know, obviously after taking the history, think about investigations. The most common would be an ultrasound scan to image the womb, and you can see them quite clearly on scan. And sometimes you may actually need, you know, more detailed scanning, such as an MRI scan, depending on how big they are and where they're protruding into. Or if you're planning surgery, you may also want an MRI scan to help you to, you know, get the location right and decide the right kind of procedure. Sometimes they'll be found incidentally. So you're going for a scan for something else and then you just see them. Okay. But the thing about fibroid is that they can get bigger. So you may have a scan and they're 1 to 2 centimeters. You leave it alone, and in a few years' time, you have another scan, and all of a sudden it's 10 centimeters and causing different problems. So those are the sort of usual history of finding out, you know, symptoms, presenting, finding out. Once you find out that you have fibroids, then it's about the treatment. A lot of times doctors, you know, would say that, well, if you don't have any symptoms, you can leave them. But that's a risky thing because you could leave them, but they may get bigger. And when they get bigger, they can cause problems. So you have to have quite a detailed conversation with your doctor about the value of watching and waiting, you know, monitoring or doing something active. But a lot of times it also depends on how much it's causing problems for you in your day-to-day life, and also what the treatment involves, because some treatment is more easy to deal with, but other treatment can also be more difficult. So it's always weighing up the pros and the cons. In terms of pregnancy, getting pregnant can be difficult because if you imagine these fibroids that are, in the wrong place, they could obstruct the egg from coming down. To get pregnant, you have the egg that comes down, meeting the sperm, and then there's history. They can obstruct that transportation process. Once the pregnancy is created, it needs to implant, and it has to implant in the womb so that it can grow. And if you imagine you have fibroids poking inside the lining where that should happen, then that's risky, and you can have miscarriage. So, you can lose the pregnancy because of the internal fibroids. Okay. Fibroids also compete for blood supply with the fetus. And therefore, that can also put the fetus at risk of poor growth. So you can have growth restriction where the baby does not grow very well in the womb because it's competing with this fibroid for the blood supply. The other things that you can have in pregnancy would be generally imaging is difficult. Imagine you've got a fibroid that's 10 centimeters and you want to scan the baby. It's in the way, so you don't always assess, you're not always able to assess the baby properly. We tend to use fetus, so I'm saying baby because just to make everyone understand. But when I say so fetus is when the baby's in the womb. And so therefore it can actually interfere with your imaging. So you're not even able to assess properly, which has an impact on growth. So you're not able to assess how the fetus is growing well if you can't see, So it can cause problems like that. You can also have premature birth because the womb can contract easily because the fibroid is just in there in the wrong place. So you can get a tendency of having an early birth, and as I said, a small baby. And then also how the baby lies, or I say how the fetus lies in the womb. Typically, you would have the head down, okay? But imagine you've got something at the bottom that's stopping this head from going down. So you'll end up with the fetus going sideways, or which is transverse lie or breech when the bottom is coming first. So the presentation, the way in which the fetus lies within the abdomen, within the womb, can be changed because of the fibroid. And then this can also have an impact on needing a cesarean section, because if the fetus is not lying in the right orientation, then you may need to have a cesarean section for that. If you've had fibroid surgery before, depending on the type of surgery that's performed, some of the more complicated ones would mean that you would need to have a cesarean section because it would be too risky to go for a natural birth. So fibroids have quite a few implications. Another thing that you can also get is because they can grow during the pregnancy, you can have pain. So as they grow, they kind of get softer, and that process creates pain for the women. So all the time, they're complaining of pain, and it's just this fibroid causing problems. And then I suppose once you've delivered, fibroids can also cause a lot of bleeding, because when a woman delivers, imagine the womb has become so big, all the way to the top of the chest. After the baby comes, the womb has to go back down to its normal size so that, you don't see it. And that process, when you have fibroids, it's harder. That contraction is harder. And during that time, you can have bleeding. So there's risk of bleeding after birth if you have fibroids. So overall, they can cause problems, but there are different treatments available. Treatments to manage the symptoms, or treatments to manage the complications. So non-surgical methods, which usually medications, or the surgical methods, which mean having the operations. And there are lots of different types of operations. There can also be ultrasound, focused on ultrasound, that can sometimes shrink the fibroids. And there's another process where it's called uterine artery embolization, where you obstruct the blood flow to the fibroid, and that way it helps to shrink the fibroid. Generally speaking, after the menopause, which is the natural process when the woman's hormones decline, that can also help to shrink the fibroid. So you find that as women get older and they go over that period of time, the fibroids tend to cause less and less problems. So I've been talking for a while. Do you have any questions?
Yes, we do. I mean, I was gonna let you just keep going till you get to that point of presentation. Then we're gonna go ahead and just throw in some questions. But we do have some questions. So if you want us to, weave it in with the questions, well, I can start right now if that is okay with you. All right, so
Okay.
let me go ahead and set the rules out real quick. I see that um, Augustine has the hand up. We're gonna read our questions first. Then after the questions are done, we're gonna allow people to, call in, state where they're calling from, and also ask their questions. So Augustine, you're gonna definitely be my first person to call once I'm done. But let me read these questions first. Okay. Um, the first question that we have um, is coming from Simeon. Simeon asks, can it be cancerous?
So fibroids are typically described as benign. So that means that they're non-cancerous. They very, very rarely you can get a sort of like a cancerous transformation within a fibroid, but that is very, very, very rare. Majority of them, and most commonly, fibroids will be considered non-cancerous condition.
Okay. Well, so even though you get to see it protruding in your loved ones, family members, you shouldn't be too alarmed on the cancer part
Definitely,
because
you should not be alarmed. And the wonderful thing about fibroids is the imaging is very clear.
okay,
With a normal ultrasound, when you see them, you see them. You know that they're fibroids. And, especially with things like MRIs, it's very, very clear what they are.
okay. So how do you differentiate between a woman being pregnant and being fibroid? Because I think I have been, out of ignorance, I was excited for a friend and just for her to be like, oh, no, I'm not. It is because you just see somebody for like 6 months, the next 6 months, and it looked like she was pregnant. So I was excited. Oh, thank God. Like, you're about to like have like something is cooking, and she goes like, no, I'm not. It's fine. I felt so bad. I had to apologize. I apologized 1 or 3 or 4 times on the spot. So how do we tell if something is fibroid so that we do not make such a mistake? Maybe again, due to our personal relationship, I thought it was okay to be excited and um, you know, eh, 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 share the joy that I thought was, but then wasn't. So, in order not to meet that kind of facade, how do we differentiate between that?
All I can say is never make assumptions about anything. It's difficult. I mean, obviously, that's the problem that you can see somebody and you can think that they are pregnant, you know, and it's obviously the pregnancy test will tell you that somebody's pregnant. That's a biochemical test, so that proves pregnancy. But if you're just looking at somebody, you won't necessarily be able to tell. No.
It's very very close because you can tell when somebody gain weight, and that will be easy to identify that. But with that fibroid, the way it protrudes kind of makes it very difficult. Missy asked, when you realize you have a fibroid, do you have to take it out immediately?
So again, this is where there needs to be a conversation with the doctor, because it depends on how, number one, the problems that the fibroid is causing the person. So, is other symptoms interfering with day-to-day life? Can you go to work? If you have a woman that's having heavy, heavy bleeding all the time, is it possible to go to work? and be functional and tired or look after kids. So number one, the pain, are you able to sleep? Are you able to, so if it's really interfering with the quality of life, then there has to be a conversation with the doctor about the benefits of doing something. I think the traditional thing of, well, if they're small, you don't need to do anything about it. A lot of health professionals, would say that, but it's really important to have that conversation with the doctor about, if I leave it, what will happen? I think that is the bigger question, because sometimes you will leave it and then in another 3 or 4 years, it's grown 2, 3, 4 times the size, and then you have to deal with the problem. So it's almost like you have to make up your own mind, and you have to be well informed, understand what this condition is, and then you'll be in a better position to decide whether you think it's worth leaving it or doing something about it. Leaving it doesn't mean that you don't do anything about it, because you can always have additional monitoring. Perhaps you could have a conversation with the doctor. Is it worth scanning every 6 months to see if it changes? And then that way you're still keeping a close eye on it, but not necessarily doing an active treatment. I think, that approach is also fair. But as I said, it's always an individual conversation between you and the doctor to decide what would be the best method for you.
Okay. Thank you very much. Augustine asks, please, are we allowed to ask questions? Yes, you are. Like I said, Augustine, you're the first person. The next one is going to be iPhone, and Atinka will be the third person. But what we're going to do is we're going to go through the questions that are typed first. Then after that, we're going to open up for incoming calls. So this question was sent to me direct, so I may not mention the person's name. Can you please ask this question for me? Can you ask her, what are the chances for someone in their late 30s who has had 2 fibroid treatments, one through UFE and the other through laparoscopic ablations, using a CISA to get pregnant?
Again, it really, depends. Because any kind of embolization, and so embolization is where the blood supply to the fibroid, if I understood the question properly, is obstructed. So less blood is going to go through to the uterus, and the whole idea is that the fibroid is going to shrink. But then because the blood supply to the whole area is going to be reduced, then if you want to get pregnant, then you have to bear in mind that that area is not going to be as well vascularized. It's not going to have the perfect supply in order to do that function. Similarly, if there's a lining of the womb which is healthy, should be, this is the lining that's shed every month. If there's a procedure that thins it out in order to reduce the bleeding from fibroids, then it's not going to be able to function at its maximum. So potentially these procedures can have an impact on long-term fertility. And again, this is where you can never say never. That's, but they can affect the rates of pregnancy. And this is where you need to have that clear conversation with your healthcare provider about any procedure you have, what are the risks, what are the benefits in the future? If I want to become pregnant, what's going to happen? Can it happen? And then you're in a better position to make that decision. So I think those procedures are more tricky, in terms of becoming pregnant. But as I said, you can never say never, but the data for it is not as strong for pregnancy.
All right. Missy asked, when do you have a low hormones?
In terms of women, well, then
Right.
at the end of the way men have testosterone, right, as they become teenagers and their testosterone goes up, women have their estrogens and progestogens their whole life, and then when menopause happens, those cycles, those hormones start to go down. So after the menopause will be the time in a woman's life where her hormonal levels are at their lowest. Yeah.
Okay.
So that's like 50 plus.
Ominike Araba asks, if fibroids are outside the womb, would a C-section be dangerous?
Again, it depends on where, the location. And we do cesarean sections in women with fibroids all the time. So it all depends on where they are. The biggest risk is bleeding because, as I explained, the uterus needs to contract down. And the ones that are on the stalk, which I call the pedunculated ones, to be honest, if they're out of the way, they don't always cause problems. It's the ones that tend to be in the muscle or the ones that are at the where you need to cut. Sometimes you need to make a cesarean section, you need to make an incision in the womb. And the ones that are at that point, at that location, that can be the tricky ones to deal with. So it can make cesarean sections more complicated, yeah. But again, it all depends on where they are, how big they are, how many there are.
Okay, I think I asked, can you describe in details what the non-surgical process are? You mentioned medications.
Yeah, so there's all kinds of medications that are available. For example, okay, so the best way to think about it is that the cycles, the way the female hormone cycle works is that whenever you have the high estrogen times, that's what's going to make the fibroids grow. So things that are going to stop the cycles will generally help with the symptoms. So, for example, hormonal contraception, so oral contraceptive pills, or intrauterine devices that contain hormones, they tend to help with reducing the symptoms of the bleeding, the pain. You can have other types of hormonal medications that are a little bit stronger that can almost put women in menopause where they completely stop the cycles for a long time. But again, the problem with that is that, which differs from the oral contraceptive pill, is that there will be times where at least your symptom, you may have breaks and have your cycles, but your hormones will be not as affected as much. Whereas the stronger medicines can put a woman in menopause, and you'll get hot flushes, and you'll feel like the cycles have completely gone. So then you've got just simple tablets that can help to just reduce the amount of blood loss. So there's a variation. There's numerous ones that are available, but again, it all depends on the side effect profile.
Okay, thank you. Godfred asked, I missed the early part of the session, so pardon me for asking this. What causes fibroid? Why do women get PMB as a result of fibroid? So, Godfred, you can still get this full session on YouTube, HRE TV, and man, it's going to be down. I'm also going to share it on HITV WhatsApp chat room so they can have access to it. And also, please make sure that you join the link when the producer drops the link in the chat. Also, director, please make sure that you put the Friends of Startup Send chat link as well so that others can join and discuss topics concerning startups and anything that they want to know concerning the app. Fatih Bamba asks, well, with Godfrey's question, do you want to answer the PMB part?
Sorry, if you can repeat the question again.
Why do women get PMB as a result of fibroid?
It's just PMB as in explain the abbreviation so I'm
I have
understanding.
no idea what that stands for. Godfrey, come again. Once he brings it back, we can go ahead and go details. I have no
Okay.
idea. Fatih Bamba asks, can herbal treatment help in curing fibroid?
No, I don't think so. But I think that, with anything, if you study your body and you know what's good for you, there was some evidence, for example, that some soy products, a couple of studies showed that you could have more with that. But it's, if you eat certain things and you know that there are good things for you, you will know. So I think study your body, and study your diet and see, what you eat and drink that helps you or makes you feel better. Sometimes we've got to also heal ourselves. It's not every time that we have to look at what is out there. We have to study ourselves and our bodies. We have to keep ourselves well. Obesity is a factor, definitely. So if you keep your weight normal, because it's with fat cells store estrogen, And estrogen is what the fibroids love. So if you keep the fat cells away, look after your body, hopefully that will also help to improve, those symptoms, or at least will prevent them from getting too big. So these are just natural, healthy living, good exercise, lifestyle that will have an impact on fibroids. Yeah.
So there are two questions before this one that I'm about to read, but since the question has already, surfaces, I would like to talk about it. Samuel Agboke said, yes, with neem leaf boiled together with limes. I'm a herbal doctor. And Fatih Bamba was like, really? And Charles Asante said, this is false. My producer went to respond to that. So I
I haven't,
guess,
I've never heard of that.
yes.
And
So
so
again, I want to state this over here. Please, I have no idea who Samuel is and what he does. So with that being said, we have no means of any control over what he does, whether what he's saying is tested in trial and proven, and that it's been sanctioned by the FDA in Ghana to proceed or not. But then again, if you whatever information that you pick over here, you do it at your own risk. So you have to make sure that you do your due diligence. Those that we have, verified are the ones that we, invite to come and talk about it. In the future, if someone wants us to have a conversation, we can do that. By no means do I condemn what he's saying, because for all you know, he's actually having some remedy over there that can help our mothers out there. But we cannot confirm or deny that. So please make sure you do your due diligence.
I've never heard of that. But the only thing I will say is that having a healthy lifestyle is good for everyone. So eating healthy foods, exercising, keeping your weight down, that is good. Everything else, I've not heard of anything like that.
Okay. Can fibroid cause what is it, bladed ovum?
That's a completely different condition. No, it's not
Okay.
related to that. A blighted ovum.
Okay, that was from Ernest Boydu. Ominike Araba comes again and says, after menopause, do the fibers go away completely? Do they completely shrink?
It's a very good question. Traditionally, this is what we would expect, but everybody is different and everybody's body will behave in a different way. And also the speed at which they will go away is unpredictable. So yes, they'll shrink, but how quickly will that be? And does that mean that the symptoms will immediately disappear? So we're all different people. We are all individuals. We're different heights, weights, all sorts. So with medicine, it's always got to be individualized. That's the only thing that works. Your doctor will take your history, will assess you, and will not say that, okay, this works for this person, so therefore it's work for you. Yes, we have general treatments that we apply to everybody, but ultimately it's always an individual. And also it's a conversation. What you may accept as a treatment option, another person may not accept it.
Okay. All right. Someone asked, and what are the symptoms of fibroid? I know you already talked about it. You want to just touch it a little bit?
Yep. So heavy, painful periods, irregular periods, feeling bloated, having a, biggish tummy, problems with the bladder, bowel, so constipation, urinary frequency, painful intercourse, fertility problems. There's a whole range of symptoms.
All right. AKA or Aka asks, is it true that when you treat fibroids with medication and they shrink, they tend to grow back when you stop taking the medication, sometimes getting even bigger than they originally were?
That can happen, and that can happen because you have seedlings. So it may be that the ones that you already treated shrunk, but then there were other seedlings that popped up. And the seedlings, when I say seedlings, we're talking about tiny, tiny little ones that can grow all the time. So this is why sometimes we just use that whole term fibroid uterus. We don't just say, as in, when we say fibroid uterus, it's like the uterus has got multiple fibroids. It's not necessarily just a fibroid, but it's that condition and understanding that this can happen. Yeah.
Okay. S asked, if one goes for the surgery, what would be the best remedy post-surgery to maintain a healthy body or keep the fibroids from coming back? Doji, I see you. I will call you. You're the fourth person on my list, so just bear with me when it comes to the call.
So there are different types of surgeries. There are the non-invasive types where they're more like keyhole, okay? So they can be done from the inside. And then there are the more complicated ones, myomectomy, which is removing the fibroid again. That can be done from the inside or from the outside. Or abdominal surgeries where you make a cut on the abdomen, or the keyhole to remove the fibroids. Or the last resort is actually removing the womb, which is the most, complicated, or I would say the most final surgery, because once the womb is removed, it's removed, which means that obviously that womb cannot carry baby anymore because it's not there. Okay.
Nice. Eunice Day says, can fibroid expulsion occur naturally?
Generally speaking, something like that is very rare. Something like that is, but I've never heard of that happening. But I mean, if you look at the textbooks, you might find a case report of something or other. But it's not something that it's a common occurrence, I would say.
Okay, your namesake, Jacqueline asked, how severe is subserosal fibroids with 11 by 30 millimeters?
So in terms of fibroids, in terms of worrying about them, particularly in pregnancy, when they're sort of 2 to 3 centimeters, less than 5 centimeters, the risks are, or the chances that they can cause problems in pregnancy are fewer. If they're over 5 centimeters, then they're more likely to be causing symptoms. However, it's always, you cannot necessarily quantify, and say that, well, if you have a fibroid at 2 centimeters, it's not going to be causing you problems, because the problems are different. It can be pain, it can be irregular periods, it can, you may have somebody that has what looks like small fibroids, but they're still having problems with them. So it's, as I said, I keep going back to this, that it's very different for different people and it's very individual. So just the fact that you have them in itself means that you can have any type of symptoms. Yeah.
Okay. Phyllis asks, is it true that certain milks like soy milk can spike estrogen?
As I said, I think there was a study that found an association, but with having fibroids and soy, but it's not, that you might have one study here or there, but it's not necessarily a common thing. So that, and when I say that, it's not enough. The evidence is not enough to say this is a definite association, so therefore don't do it. So it's absolutely fine to have that because the evidence is very weak. Okay, so when we look at evidence, we look at something that's a very strong association, meaning that, yep, definitely it is there. And then we talk about hearsay. Well, you may have had 1 or 2 case reports or 1 or 2 people that have experienced this, but overall, it's absolutely fine. So, and if there was very strong evidence, then that would have been stated. So I would say that for the moment, if that's what you have, keep having it. There isn't any concrete evidence to say not to have it. So, when I talk about all of these things, I'm telling you the history. I'm sort of trying to help you to understand the conditions. But by any means, everything is, I would say if you enjoy these products, then that's fine for you. I think what you can do, though, is speak to your doctor, which is what we keep saying about these things, because everything is very individual. Speak to your doctor about it, and speak to your doctor who knows you, knows your diet, about, is this good? Is this okay for me, or is this not okay for me? Because everybody is different.
All right. A very good one from Vida. Vida asks, can an anti-inflammatory diet help reduce fibroids?
Again, I don't know the evidence of that. I don't know. I think with that, your best bet is to speak to a nutritionist.
Okay. All right. Producer has, dropped the link to our HITV chat room. Again, the purpose for that chat room is to discuss topics that we want to see and treat on the show, Time with Tatapsen. Also, director will be dropping the link to the Tatapsen chat room, and that is to discuss any conversation that we have with our app or Tatapsen. If we're and I love her DP so much. It's Bepo so high, every girls. Shout out to all the every Abugis. Will you advise a woman with 8 centimeter size fibroid located posterior of the uterus to have a surgery? She was able to give birth to a healthy baby with the fibroid.
Sorry, if you just repeat that again, 8 centimeter.
8 centimeter size fibroid located posterior of the uterus to have a surgery. She was able to give birth to a healthy baby with the fibroid.
Again, this is something that again is an individual because surgical interventions can be obviously risky because of the complications of the surgery. So it has to be discussed exactly where the fibroid is, what kind of problems the fibroid is causing, what are the possible treatments, and if there's going to be surgery, how is it going to be done? Is it going to be an open surgery where there's a cutting involved from the top? Is it something that can be done with a keyhole? Because the good thing about keyhole surgery when it's done is you don't have to stay in hospital very long afterwards. You can go home quickly. The recovery is much better. So there are a lot of variables. So we can never say clearly this is what you need to do or this is what you shouldn't do. Again, talk to your doctor and get that right advice. I think the most important thing I feel about fibroids is asking questions. A lot of women will see the doctors and the doctors will tell them, well, you've got this, you've got that. But I think that there needs to be more questioning of the doctors, almost like, they tell me all the pros, tell me all the cons, tell me in 5 years, what is this going to do to me? If I leave it alone, tell me about the different surgeries, tell me about the different risks. And I think that once you are really, really informed, then you are in the best positions to make decisions, because I think when women are not informed, they might go along with something thinking that that is the right thing for them, and then only to discover that that was not the right thing. Or if they see a health practitioner that hasn't given them that information, and then later on. So sometimes it's even good to get a second opinion. So you see one person and they tell you something, and you're not clear in your head. Even as doctors, we ask each other's, we consult our colleagues for second opinions when we're not sure about things. So if you're not getting the answers from one person, go and find somebody else that it might be able to help you and give you more information. If you're finding it difficult to make a decision about, oh, should I have surgery? Should I not have surgery? See 2 people, see 3 people and get their different opinions, because the more you talk and the more you get that information, then you're in a stronger position to make the right decision for yourself.
Right. So I'm gonna ask 2 more questions, then we're gonna open up the calls for others to ask questions. Then we're gonna come back to reading questions as well. So Missy asks, I am 30 and I have a fibroid. My doctor put me on the daily contraceptives. My symptoms were heavy bleeding and I have no pain. Or so I think that would be a statement then. Godfrey comes back to say, sorry, the PMB stands for post menopausal bleeding.
I think postmenopausal. I mean, I thought so, but I wanted to just be clear about that. Postmenopausal bleeding can be caused by any number of things. Obviously, it can be caused by cancerous things, but it can also be caused by inflammation or infection. Fibroids potentially can cause that as well. But again, it's one of those signs that if it happens, it's kind of an urgent situation. You need to get it assessed very quickly because of the potential that it can also be related to cancer, cancer or neoplasm. So if that happens, really very quickly, go to the doctor. Within, a very short time, there needs to be a full assessment to exclude any pathology.
All right. Missy asks, I was also told to eat more red meat since I bleed heavily and it made me anemic. But they say red meat is not good for fibroid. Um, John Agbe says, can FUPA, FUPA, be confused with fibroids? How can an aging elderly woman cipher because she fears going for medical screening?
I don't know what FUPA is. It may be because you're in the States and I'm in England, so there's some things that are a bit different. Um, it's always, in terms of worrying about going to see the doctor, it's always worrying. I've been in, a hospital environment since I was 18. I went to medical school when I was 18. And for me, it's like I go to the hospital every day. It's like I don't think about it. And then I see my patients and they come to hospital and it's like they never come to hospital. It's like the one time they came to the hospital building, maybe that's the only thing. They've just been to the hospital to have their babies. Other than that, they don't go to hospitals. So I guess people are more anxious about being in that environment, although as I said, for me, it's different. But it's about making or helping them to understand that the place is a place of help. When you're going there, you're going to get some help and trying to, relieve that anxiety,
Okay.
providing support.
The first on my list was Augustine. Augustine, if you are still here, can you please unmute yourself, Augustine? After Augustine, the next person was iPhone, and there's so many iPhones. I don't know which of the iPhones. If you can put your hand emoji back up, I will mute you for you to ask. But until then, we have Antika, who was third on the list. Antika, if you're here, um, put your hand up. So please, those of you that had your hands up earlier, if you can put your hands up, I will go ahead and call you to ask your question. Then we're gonna come back to the questions readings after.
I would just like to come back to the question about soya because there were just a couple of studies and many other studies have also found that there's no association with that. So I think that if you do eat those products, there's no evidence to say that you shouldn't eat them.
Okay.
Just to-
Guest, can you please unmute yourself for me and tell us where you're calling from and your question, please?
All right, PK. Thanks very much for this opportunity. So I'm Augustine from London, and
Hi.
then hello. It's so funny. I was researching on this fibroid thing this afternoon, so around 12-ish, because a cousin of mine has been through some situations that I'm very close to her, so she speaks to me a lot. And then the crux of the matter is she's a 24-old year who has tried 3 times getting pregnant and it all, didn't work out. I think the recent one was I think she was about 3 getting to 4 months and then just randomly at work she started bleeding. So she had to go to the hospital and then she was told she's had a miscarriage. And that's a recent one. But before that, I think somewhere last year, beginning of last year, she was pregnant and then I think it was a month old. It turned out that it's turned ectopic. So they would have to, you know, um, perform an operation and take it out. And then prior to that, I think the year after, she also got pregnant. I think that didn't last up to a month. And then she randomly had a miscarriage. So it's been 3 times. And she's been told she's got fibroid, which is, a bit strange to me, a girl of that age. And so imagine dating it back, it means she had a fibroid when she was like 20, 21-ish. And then she's been told that is bigger. These are like big fibroids. So I'm wondering, and they're not doing anything about it, because I feel like if she tries again, she's going to end up with the same situation. And the hospital are not advising on what to do. They just tell her that and, advise her to try again. And I feel like nothing is going to change if, something is not done, because 3 times,
All right.
So
advice.
pregnancy loss is very, very difficult, and pregnancy loss can be caused by many different things. And of course, having fibroids is one of them. What usually happens is if a woman has had a few pregnancy losses, then they can be referred to a type of clinic called a recurrent miscarriage clinic. And this is usually more detailed clinic where they look into the causes, they do investigation, they do scanning, they can do blood tests to try to understand what is predisposing this, what is making this happen. So I think that's very important. I think seeing the general practitioner, and the general practitioner is like the family physician, family medicine. You go to them before you go to the specialist. At least in the UK, you can get referred to these type of clinics, and then they will do these investigations and then hopefully give you the right idea. It may be that the fibroids, because again, in some situations, fibroids need to be removed in order to allow that pregnancy to happen. Or it may not be. But again, it's a very personalized, thing, and it all depends on what the actual cause is. And sometimes actually the cause may not even be related to the fibroid, it might be something else. So there needs to be a thorough investigation of possible causes, and then decide on the best course of action after that.
All right. I think, can you please unmute yourself? Tell us where you're calling from. Guys, we have about 28 minutes to wrap it all up. So that means all the questions and all the ones that were typed, including our sign-out message and everything. So please, let's make our questions very snap so that others can get theirs in, so that we can go back to reading questions that were typed. Antika, please tell us where you're calling from, your question.
Hi, I'm calling from Pennsylvania, and my question is kind of like pregnant. So I have a sister here that we were able to tell that she had fibroid from the way that her fupa was growing, and the fupa is the fat upper pubic area. And so, like Doc mentioned, she was like going to the hospital, she was exercising and all that, but still, it showed how much her tummy was kind of growing. And we have visited the hospital for a couple of times, and the doctors seem not to have much interest in that, apart from putting her on pills. And so my question is, does the fibroid, like, at what point is she able to try for pregnancy? And if that comes in, let's say she stops taking this medication and she gets pregnant, after that, will she be able to push the fibroid out? How would it work after pregnancy? Does the symptoms still come back? And the fact that we don't have a lot of Black doctors around, sometimes it's hard to kind of like voice out how you feel about such things like this. And it's just the normal system that they put people through. So I'm curious to know how people can seek help, or Black women can seek help outside of a white dominant area.
It's a good question. I mean, again, I've practiced mainly in urban areas. So I've always been in a sort of very multicultural environment. Because I trained in a big city in London, and there were lots of doctors from all kinds of backgrounds. But in a more rural parts of the country, the situation might be different. But it's wherever you are, you have to advocate for yourself, and do the best to get as much information as possible. One of the things that we have here, I don't know what it's like in the States, is we tend to have like a lot of like charities available that support health conditions. So one approach can be seeking advice from some of these if they're available, because sometimes, so for example, there might be like a fibroid association, or and then they would support. Again, I don't know what it's like in the States, but if there were similar groups, and that they could be a potential group to contact, because they may also be able to give you some advice, because there may not be many Black physicians, but there may be one or two, if not in your city, maybe nearby, that would be able to support. So I think it's really looking out for any kind of national organizations that would support, be it charities, nonprofits, and seeing whether they can help as well. But I think advocating is really, really important. If you ever have a health practitioner that you feel is not listening to you, try and get a second opinion.
All right. iPhone Linda, please unmute yourself. Tell us where you're calling from and your question.
Okay, finally. So I'm
Hi,
calling
Linda.
in from hi. I'm calling in from the US. I am currently going through the motion. So I'm currently pregnant, and I went for my first ultrasound, and I was told that I have multiple fibroids. Most of them are subserosal, but I have two intramural ones, 10 centimeters on the right, 8 centimeters on the left. But where the baby is located and everything, it doesn't have any fibroid activity. And I don't know what to do. So, like, all the doctor did was just bombard me with worst case scenarios. I've already had open myomectomy 3 years ago, so I wasn't expecting it to grow back this fast. I got married, and naturally I would want to, get pregnant and everything. And this is my first child, my first pregnancy. And then I got hit with this. So I don't know how to process it. I'm trying to be positive. I'm trying to, not think too much about it now. I have to go back every 4 weeks to be checked, because they said I'm high risk. I don't know, what the best case scenario is for me right now. I mean, I heard the worst case scenario. So, what advice would you give me?
As I said, thank you for sharing your story. It's really always brave to, come out and let people know, it's, your personal situation. With all these things, I believe that it's always comes down to finding yourself a good healthcare practitioner that hears you, and information overload can really be difficult, because the way in which information is delivered, it can be complicated or it can be simple, depending on who gives that information and the skill. So it's really important to find, an OBGYN, that's you say on your side, that will support you, and look at your whole, your own history, and then give you the right advice. As I said, it's easier because I can see here in the UK, we have a lot of sort of charities, that so for example, in the UK, we've got the British Fibroid Trust, and it's like an organization, and it's there to provide, balanced information. So it's not necessarily, it's just general information, and it's supportive. And we have different things like that for different conditions. And sometimes if you're not able to speak to your own, you can always seek that additional support from there. And I'm sure the States, it's a huge, huge country, there will be something similar like that, if not in your own city, at least in some of the other cities. And then obviously you've got the American Colleges of Obstetrics and Gynecology. Again, I'm pretty sure that they must, if you approach them, I'm sure that they would also be able to have resources available that you would be able to access just to get that additional support. But I think, try and speak to your own practitioner, and then also if it's difficult, get a second opinion. There are many women that, go through pregnancies with fibroids and the pregnancies are successful. So it's not always, don't be too alarmed when you get this information. I mean, it's healthcare professionals always want to give you as much information as possible, so that you are fully aware of what the good things are and what the bad things are. But overall, they have been looking after women with many complications for many, many years. So don't be alarmed.
All right. We're going to go to Doji, CAD, and also good luck to our sister who just spoke. I pray everything goes on well. Doji,
Hi, good evening. I'm
good
calling
evening.
from Florida.
All right.
Okay. Um, I'm sorry, but just to the person who spoke last, I just want to let you know that I've had three friends who sometimes they got pregnant and then they realized that they had fibroids. It was alarming, but you just need to be really positive, eat healthy, stay away from carbonated drinks, cook much green leafy vegetables. If you're Ghanaian and someone is coming over and you have turkey berries, you can drink that. It helps with the iron levels and all of that. So
By the
it's
way,
overwhelming, but
those of you who don't know Techie berries, consiswa, that's what sister talking about. Go ahead, Doji.
so my question is, I went through a surgery for fibroids and then um, all the symptoms had disappeared. So I began having normal symptoms. Like I had febals. It wasn't like it used to be. Bleeding had stopped, and I had regular cycle. I checked after 2 years, and the fibroids had not returned. But all of a sudden, the cycles have gone back to irregular, very irregular. It's there today, it's not there tomorrow. Um, and it's difficult because I think in Ghana it's easier to regularly check than where you are here. It's more difficult because it depends on who your primary doctor is and how much information they have access to. You read, you're trying to do all the right things, but because I literally checked about 3 months ago and the fibroids are not there, but your
Okay.
cycles are back to being very irregular. So
All right.
you're wondering, like, what is it? And you know that the irregular cycle was due to the fibroids and now it's gone and all of that, but the cycles are messed up
Okay.
again.
So, due to time, sorry, Doji, I have to cut you a little bit. So, Doc, can you please help her with fibroids being gone, but still irregular cycles happening?
I think this is what I was saying before about the condition that, with fibroids, they're very unpredictable. And I guess once they're there, and they've gone, they can come back, or it's just the way that they are in the womb. They change the structure of the womb, and that in itself can lead to symptoms. You know, with recurring symptoms, it's always important to go back and get investigated. And getting investigation is really important because many times you may think it's fibroids, but it's also, you have to look at other things as well. So don't always assume that it is a fibroid that is creating problems. It could be just go back and get your practitioner, knock on the door again, get your practitioner to have a look all over you again and see whether or not it's anything else that could be contributing to the symptoms, because we cannot always assume everything is just fibroids. We have to also think, you know, in medicine we say differential diagnosis, meaning that if we're thinking that, okay, this is the one thing that we think it is, but these are the 3 or 4 other things it could be as well. So it's really important to consider the overall picture of multiple things. But getting investigated, seeing your doctor, and having that second check, third check, and trying to work out what is going on and what can make it better.
All right. We're going to call Betha to unmute herself, tell us where you're calling from. Please make it quick so that Zion can get in and we can go back to asking our questions. We only have 15 minutes left.
Thank God I made it this time. Oh boy. Hi, everyone.
If you want to make it all the time, please raise your hand first.
Hi.
All right, Betha.
Hi, Doug. Thanks for coming.
Hi,
So,
Kate.
I've been listening to this conversation, and it's very, very educative. And everything that you're saying right now, it's true, because the hospital, it's a place for us to go and check for our health, and that's where we have to be every year. But some people do not do it, and when in terms of this fibroids, it's very, very deceptive when you don't see your gynecologist, and when things escalate, forget it. They grow so quickly. This is a personal experience for me. So mine was growing. I think it did rapidly, and the surgeon who was supposed to do the surgery told me, "Oh, I can't even handle you. I have to give you to somebody else." And God being so good, I got a professor herself, and she was able to help me. So, I mean, we have to be checking this periodically, and we have to be visiting our gynecologist. Thank you.
Thank you,
Thank you
Betha.
for sharing.
All right. Zion, can you please submit yourself? Tell us where you're calling from and your question.
Okay, thank you. I'm calling from Virginia,
Yes, sir.
and I have this thing that is bothering me. I really don't understand the connection over here. How is fibroid and diabetes related? Because my mom has been in Africa for just 2 weeks, and she started feeling uncomfortable, not too good. You know, she was sick. She went to the hospital just last week, and then they realized she has fibroid also. So the doctor said the fibroid has to be removed because it's causing her blood glucose to be unstable. Today is 180, tomorrow is 600. This morning it was, I think 79, afternoon was 390. And she's taking her medicine, all right. You know, she was taking metformin, glyburide, metformin, and then she went to Ghana. The doctor said she has to change the medicine. She gave her Vitacrity, or I don't know what that kind of medicine is. But then it was helping, but then the next day it went up to 700. So just last week she went to the hospital. They realized she had fibroid, and then the doctor said they have to remove it because it's not making the blood glucose to be stable. And I can't think about this far. How this thing is related.
It's if I'm being honest, I haven't really heard of that association, and I would think that those things are separate, but I think again each person is individual, and that's where she has to obviously discuss with her own physician and see what they say. But it's not something that I've heard of that association.
All right. Thank you very much, Zion. So now we're gonna use the next 11 minutes, but not all of them, but 7 of the 11 minutes to go through some questions. We have 25
I
questions.
think if I come back to that, the only way that, you know, in terms of mechanisms is obesity, because as we said before, is when you have obesity can be associated with obviously risk of diabetes, and having extra estrogen can also make fibroids grow. So it may be that a few things are happening together and each thing is fueling the other.
All right. iPhone asks, how long will it take you to recover from surgery before giving birth?
It depends on the kind of surgery that has been performed, but you would, and how complicated the surgery was. But again, and each surgeon would give you that advice. So again, that is a personal one. There's no general thing to say, because if you have an abdominal surgery years ago, if you have abdominal surgery, you'd have to be in hospital for weeks, you know. If it's laparoscopic, if it's keyhole, if it's open, so there's so many different types of surgery. So it really ultimately depends on the surgery, what has been done. There's no one answer for that. No.
Okay. Erica asks, can having fibroids cause mild bleeding or spasm post sexual intercourse?
Yes, possibly, yes, just because of
All
the
right.
location, yeah.
Doris Mensa J says, is it true that you can't give birth after myomectomy?
It depends on how, no, that's not true at all. And it also depends on the kind of surgery. With very, very complex fibroid surgeries, it may be that you have to have a cesarean. So if the myomectomy has been done in such a way that the inside of the womb has been breached, if it's a very deep fibroid, in those situations, the obstetrician may say, you know, you've got to have a cesarean. So you know, as in, we're not going to allow you to have a natural birth. So it can have an impact on the type of birth you have, but it doesn't mean that you're not going to be able to have babies again. It all depends on, again, fibroids are strange. It depends on where they are, how many they are, how big they are. That just determines a lot of things.
Okay. Gaffer says, I think people need to be careful when it comes to fibroid and supposed or claimed herbal treatment. I used to work at the histology department, and most women who resorted in herbal ended up with a surgical procedure to remove the fibroid noodles because they never melted, but rather kept enlarging. Okay. Abba says, can one still have fibroid symptoms shortly after? I think we already answered that. Asanto says, when one is recommended hormonal treatment for fibroids like Ryoko, is the chemical menopause caused by the medication always reversible? And can such drugs cause any illness like tumors or cancer in the future, even after the drug has been stopped?
I can't answer that because I'm not familiar with Ryoko. So
Okay.
yeah.
All right. And also, please, A class has dropped the link to the Tatapsen, Friends of Tatapsen link. Please click on that. Be part of the family to discuss anything concerning Tatapsen. Nana Kuma says, a boogies in the house for real. That's true. And AKA or Aka says, when fibroids affect the growth of a fetus in the womb, are the babies able to grow normally once they are out of the womb, or do they have long-term effects? Good question.
It's a very good question, but there is a risk of growth restriction during the pregnancy, but once babies are born, then they're looked after by the neonatal doctors. So hopefully they're able to optimize the growth or catch up. Whether long-term effects, some babies may always be a few months behind other children similarly, but overall, hopefully they would be able to catch up. Yeah.
Okay. Missy, I think we asked the question already. So yeah, it's already been answered. Because of time, I would like to proceed. Godfrey says, thanks very much. Atenka says, fat upper pubic area, FUPA. I have heard this term before, but I didn't know it was a medical term. But it might be a slang. It might be a medical term. I don't know. Um,
I will tell you, today is the first time I'm hearing this.
yeah. Okay. iPhone says, I'm here. iPhone, okay, you ready to call? My hands are up. I'm unable to mute. Okay, we already go. Oh, come on. I'm still here. Don't skip me. I, for Linda, already called you. All right. So, what are the chances of getting pregnant after getting the surgery?
You know what I'm going to say? It all depends on the type of surgery and the counseling that's been done. You should have that conversation with whoever performed surgery before, so that you know what the numbers are, you know what your chances are, and you know what the surgery is for you.
Okay.
Ultimately, yeah.
Isaiah, you asked a question. I feel that I thought you spoke already. I think she spoke already. Yeah. Maybe the message is delayed. Okay. Um, well, good. I was looking for this link. So Dr. Jacqueline dropped a link in the chat. Please, producer, try to put that link on the HIT chat room. Dr. A class, can you put that link on the HIT chat room for me too? So that others can click on that to go learn more from that as well. So please make sure you click on that link in case you will try to learn more from that. Um, iPhone 12 Pro Max says, "Hi, someone told me that after 2 times surgery of fibroid, it is not possible to get pregnant. How is it? How is it true? Let's say, how true is it? Please, because I have been married for 3 years now since my surgery, but still nothing never, but still nothing never missed my period. I have tried everything, but no avail. Please, could you give me some tips?" And just drop some links over there too. There's some nuggets in there. Please, guys, click on the link.
Again, as I said, it's really important to get second opinions. I think our people, okay, we're not always used to doing this. It's my kids tell me off. If I go to a restaurant and I get food I don't like, I want them to take it back. Either I want my money back or I want something else that's better. I'm in my family. They think I embarrass them because if it's not good, I'm not having it. And you have to have that same approach with your health. If you are not getting the answers that you expect, you need to go back and ask. And if the person that you go back to is not going to share that information, you go and find somebody else. So you have to be very, very proactive with finding information. If something's not working, it doesn't mean it can never work. But you need to get the information from the right people and seek treatment from the right place. And if you're going to a place and it's not, you have to move. So that's the advice I would give, is to advocate for yourself. Google search, many of the various colleges of medicine have a lot of information available. In the UK, we would say the Royal College of Obstetricians, the Royal College of Pediatricians, the Royal College of this. There's similar. There'll be an American College of this, American College of that. So you need to go to those places and you need to find more information. And then you can, take that back to your doctor and say, hey, I looked at this and I found this. Tell me what it means. Is this something I can have? Is this available to me? Because if you don't do that, and if you don't do some of the research yourself, somebody will say that there's only 2 options and there may be 5. So you also have to do a bit of the hard work.
Okay. Abba says, is it normal for symptoms of fibroids to come back, say 2 months after a laparoscopic myomectomy?
I think when you've had surgery, you don't always see the effect straight away. So it's, it can be that you will have the effect, but it will take some time to have the effect,
Okay.
the long-term effect, because the body has to heal. And during that time, it'll be slow, but eventually, hopefully, the symptoms will improve.
I think I asked, do ovarian cysts have any relationship with fibroids?
You can get conditions that coexist, especially where you've got estrogen, which is the hormone that can be associated with many of the female problems. When the estrogen levels are high, then you can find women that have a bit of fibroids, they have a bit of endometriosis, they have a bit of, cysts, they have multiple things that are coexisting together.
All right. This is what I'm gonna do. I'm gonna run before more questions comes, because I can tell you for a fact we covered all the questions on Zoom, and We didn't really get a chance to go on Facebook or YouTube to ask the question, but then I can tell you for a fact we did. So I'm excited that we covered all that. I want to say thank you so much for coming. We would definitely love to have you again for more women topics because we need these. Our mothers, our aunties, our wives, sisters, partners need this information so that they can help, equip themselves better as we age and also as we develop as humans. But before you leave, I'd love for a director to sign you out, and we'll definitely talk back door to get you back in as soon as possible. Director, can you please sign Dr. Jacqueline BAMFO up?
Thank you very much. Thank you so much for having me. Thank you.
Thank you. Director, you're mute.
Yeah, PK, I think you said it all. Doctor, we will thank you for the information that you've passed on to us. I think it was very good. I have learned a lot of things, and I probably will also want to be the doctor you are. So maybe in your absence, I'll be helping anyways. But we thank you very much. I mean, this information given to us is too good to our mothers, wives, our women over there. So thank you very much. We hope to see you again. I thought Piquet was surprised when I said I wanted to be a doctor. Are you? Don't you think I could?
I'm not. I mean, you didn't specify which kind of doctor, so I can't. You can be doctor of that said.
Anyways,
you already are right now. All right. Thank you very much, Dr. Jacqueline BAMFO. God bless you, and thank you for your time. But you can stick around. You might be a winner for this 100% cashback promo that's about to happen. If you did send money within the period, you might be one of them. But I want to say big thanks to all our sponsors for making this show a successful one. Big thank you and big thanks and big shout outs to all our viewers, wherever you are, from all walks of the world. I want to say thank you so much for making time out of your busy schedule, sharing the link to your loved ones and friends as well, even your enemies to come and just be part of this. This is where we sign out on YouTube and Facebook, but we still remain on Zoom. Do not miss out on this 100% cashback. Show up on Zoom and be one of the winners so that you can celebrate your money live and call it. And please, if you do win, make sure you make noise about it so that others can know that no kululu, tatap sen, papa don't know.
Okay, I beg.
At this point,
PK,
I hand up, yes.
sorry, can you keep the streaming on after the wheel picker and then you close it?
Okay,
I mean,
how long
after
is
the
that going
draw.
to take? Do you know how long the draw is going to take?
It should take within. I mean, it should take like less than 5 minutes. So yeah.
Okay, good, because I know producer has another engagement to be at. So,
okay.
Right. So, producer, please bear with us for another 5 minutes as we go. Let's say 10 minutes tops, as 10 minutes tops as we go through the draw. At this point, I'm going to hand over to director and Uncle Jimmy and A class and the rest of the team as we emerge into the Q&A session on Tap and Focus. God bless you all. My name still remains BK Ofori-Asenso. See you next week, same time. Director, over to you.
A class.
Hello, everyone, for your Mamuna Kwaba about the focus section and also the draw time and also any addressing. The day about Dr. Jacqueline Asepa, and really appreciate your time. But about 12:33 UK Hanum, and she has been on throughout the whole night. Dr. Yedawase. And also, so the Befa Sakoyan, so at the more movie UK, Europe, and so our journey show no end so. As I said, mutimi ebaye amano aye kama so yami enshamopa. And to all our winners, last week Thursday, I get drawn on a war UK air show no so no, and those who were there witness it. Those who miss out, and please check out on our Facebook page, which is Startups and Ghana SO, and you see all the winners. Then the live video is there, just as we are doing it for today as well. And then we'll go straight onto our we pick no machine so then di ejuma kama ama obi
A
bia.
class. So I think you bear well. So what about those people get emails and say, "Oh my winning no?"
No
And then
good.
bro.
So those people who had the email said Omobinino were the people from the Thursday show now, yeah, drawn, which was the France, Holland, Germany, UK, and I think and Austria. Those were the
Ireland.
people Omunya sa email no. It's a fin USA no.
Okay, so there's still a chance for some of us to win. Okay. All
Yeah,
right.
so for the USA one, this is
The
your
way
draw.
PK is so optimist. I think
Charlie, me winnie bibiada. Me winnie
Otoma
bibiada.
me film.
Me winnie bibiada. Ade, ade.
This one is the USA draw no and the baby. Initially, no, it was 100 winners across board, but that's a France, a check, I think 2-3 days to the end of the month. No, I say no. He will add 100 to it to make it 200 into the October draw. No, the numbers instead of 100 no, were a equal 200, and that is across board. Into the Omochiche, no, USA enya 70 winners, and a USA enya. So we'll go straight to the we picker no eso. It is a motion mefide so at the moment here you can see the USA for no and then so we're going to copy the winners no LS no na ye de akwakoto ye hwe picker ne mu na se won se odofo bi e wo ha na se we win bi am pacho pi ni di ma na why then one man hu ye e den e kono. Okay, fine. At the moment, entries in Korea 36,110. 36,110. It is over Hanma before I say a click so I'm a winners. No, at there, so Hanma Pacho P. You can put in the state krona or one and as a country krona or what so say UK, war Germany, war Infambian, but wait to say war Ohio and as Cincinnati and as New York and New Jersey biana pacho wetin that so na Canada pacho wetin that to chat room no ama no aye kama until ye be spend ye fidie no ama no akọ. Good. Nti ye winners yi na afidie no asesa mo egu honom no. Nti at this time no me frɛ me nua bema director Daniel no abobo winners no edin amai.
Hey, for Ajana 1, Ajana 2. The odi kind no, your friend Karen Amponsa, Stephen Brown, Michael Dente, Joseph Edu, Lolita Brown, Kwabena Jemai, Aida Poma, Abina Obin, Douglas Danso, Eric Amankwa, Wakwa Broso, Wakwa Wachum, Kofi Minta, Enoch Buadu, Emmanuel Awusie, sorry, Jeffrey Sapon and Annie Ajay, Victoria Ejapon, Mercy Jemfi, Eunice Kumalo, Mercy Amo, Mary Amoa, Dinah Boama Ajikum. Hey, Fati Bamba, Kweni, Benjamin Ansa, Love Entry, Joseph Yeboah, Florence Boache, Charles Beidu, Joachim Boy, Roger Pokenu, Alasan Adia, Mildred Sai, Emmanuel Asante, Christiana Echampon, Ernestine Smith, Emmanuel Amponsa, Kofem Kakrama Mpacho, David Ajay, Fad Muhammad, Evelyn Asamoah-Boakye, Kwaku Dua, Charles Kakeri, Dorothy Smith Akwa, Dora Kwachiwa, Emmanuel Boko, Emmanuel Esibe, wow, Clara Jan, Michael Opoku Ajiman, Margaret Titus Glover, Samuel Yeboah, Bismarck Afiye Owusu, Ruth Quay, Mercy Blabba, FNU, Fun Lizette Ikie, Carol Nash, Augustine Bafo Awua, Stephen Kusibu Odum, James Boache, Tofik Ibrahim, Bravo Strong, Mark Garin, Patrick Ofem Kakra, Arvin Kobina, Amakutin Boating, Monica Asantewa, Fidelis Kuti, Hassan Abu, Kwame Opoku Amwako, Isaac Kota, Samuel Leverett, Eric Abelbio, David Nkrumah, Wilma Michelle Sakite, Linda Mensah.
All right.
That is the winners.
Good. That's Daniel. In terms of these are the winners for 2025 October journal. Into the almost sending sika from the 1st of October to the 31st of October. No, Pamacho P. These are our 70 lovely winners. No, and I'm with the Etra Eguno. In the Pacho P. Need them as a wuti obedient womb, and as I will show you soon as say Yami wa dumna so din APM. Pacho ubet celebrate in the church mono amano aye kama and so. No about adofo so amane say the course nie nti on this note no ye besere mo aka akere mo say bomodia bo nua bi amane bomodia bi na ka kire o sister o brother even put your own penasem say 3000 draw no mo ye no e course life and nti director any pay for esa dia base reload November so from the 1st of November to the 30th of November, sike bia obesendi bia no. Yami ya aduma depending on the country I want. Wo click ubie app no there is a banner in there. Click on it. Intebe show emra efa krona owo so no. Then no hu ahia binya. Kroni bi ebenya 100%, ebi benya less than that depending on the mrana ewo nintia. Into best mupi into bonya mania. If that person is a winner, chale wa dum le pakro. Imagine was $75,000 and not £2,000. That's a winner. Chale in the brain and the bed. Into best mupi. Tell a friend to tell a friend. Those who haven't come back yet and those who are in, remind them. Say this is the promotion that is going on. And also, so within this month of November, there is another promotion in promotion. And also so nyame aduma next week Monday ebebo ndero actually mu full details as well. And I'm sure say with this Christmas is going to be very, very, very we can say palatable. It is so much. And let's spread the good news and the love of 3000 to everyone. Don't keep it to yourself. Share to your loved ones as well. And if you haven't joined the 3000 Friends of 3000 page, take this opportunity and join it so that if any update be now, you'll be among the first to hear about it as well. God bless you. And if you're a winner and you know of anybody who's a winner, we urge you and we plead with you, say, please, once you get an email or you get a call from us, say if you can give us a testimonial or an appreciation of say you're part of the lucky 100 people, lucky 200 people now, we will really appreciate it if you can do that for us, and we will appreciate from that point as well. Add a video or a message to that effect with your picture, if you remind, so that people will see say ɛnyɛ sɛ bi afidie no ɛyɛ den agya me but trudo ɛna ɛyɛ den yɛda mo ase yame ɛnhyɛ mu na on this note no I'll hand over to studio A na Uncle Jimmy and Director PK. I take it from there. Thank you very much. Director Batomario.
Okay, PK, if possible, you can just stop
Hey,
the stream.
Dorothy, we need you. Congratulations, Dorothy.
Oh, Hanum.
Yes,
Sister.
Mr. Dorothy.